So we're picking up at the ophthalmoscopic exam. So this is where you would dim the light, and you're going to go ahead and be taking note of all things internally in the eye. So starting from the distance back here and working your way in with your finger on the adjustment, go ahead and take note of the red light reflex, which is just the red light bounce back from the retina. You're going to be looking at the fundus, which is also the wall of the retina at the back of the eye. And you're also looking for the vessels, the optic disc, and the macula. That's all, everything ophthalmoscopic. After that, you roll right into the nose, or I'm sorry, the ears, yeah. So first things first with the ears is you're going to be taking note of the external structures of the ears, so the auricle and the mastoid bones. So you're going to be palpating those and inspecting those, looking for any tenderness, lesions, nodules, and palpating the mastoid bone back here, making sure there's no tenderness to palpation. So that's all external, okay? You're also going to be taking note of the external auditory canal, making sure there's nothing abnormal in there. Then you would go ahead and roll into your internal inspection of the ears. So you're going to be using your otoscope, and you would obviously have a cover on there. I'm not actually going to perform the exam, but so when you're doing that, you're going to go ahead and make sure you pull up and back on the ear, insert, and you're looking, and you're taking note of the auditory canal. You're taking note of all of the anatomical landmarks, the tympanic membrane, which would include the umbo, the handle of the malleus, and then the short process of the malleus. And then lastly, while you're inside the ear, you have the patient perform Valsalva, so you can actually see the TM mobility. Okay? And then as you're retracting or going in, you just make sure you're looking at the auditory canal. Okay? After that, you're going to perform your special tests with the with hearing. So you need between 500 and 1,000 hertz, and you're going to go ahead and strike. Oh yeah, gross hearing test is first. I'm sorry again. Gross hearing test is the whisper test is all it is. So you stand behind the patient and you just explain to them what you're going to do. So you're going to say a series of letters and numbers, and you're going to do the same thing on both sides. So example,
1 Charlie Bravo.
And then just make sure that they have that gross hearing ability. After that, you go into your special test, both the Weber's and Rene. So Weber's is you strike and you place it above the ears, and they should be able to hear it equally on both sides. You just ask the patient, can you hear that equally on both sides? Or okay. After that, you move on to the Rene. Strike. Oh, explain to the patient first, I'm going to be placing this on your mastoid bone, and you tell me when you can't hear it anymore. And then what you're going to do is you're going to move it after they can't hear that, and then I'm going to move it in front of your ear, and you tell me when you can't hear that anymore. Okay? So bone conduction should be half as much as air conduction. Okay? So obviously if this is struck, I can't hear it anymore, go here. Okay? I can't hear it anymore. The time should be 2 to 1. Okay? And those are your special tests for the ear. After that, we go into the nose. The nose is pretty basic. You're going to be observing the external structures of the nose, so you're going to be both inspecting and palpating. So you're going to be looking at the bridge of the nose, you're going to be looking at the soft tissues of the nose and the cartilage, you're going to be looking at observing the nares for any drainage or any issues with that, and then obviously test the patency of the nares. Have the patient occlude and inhale. Easy day. And again, you take your otoscope, and you're going to be doing an internal inspection of the ears, looking at nasal mucosa. You're also going to be looking at the septum, looking for perforations. You're going to be observing the inferior and middle turbinates. And then lastly, you're going to be doing your special tests of smell. So in the rooms, they have the smell test. Obviously, you have the patient close their eyes, occlude one nostril, have them smell, and then describe the smell for you. Okay? After that, we're going to go into the throat and, I'm sorry. Oh, this every time. Okay, so you're gonna palpate and you're gonna palpate the sinuses. Okay, so you have your frontal sinuses, and this is part of the nose. I just forgot it. So you're gonna palpate your frontal sinuses and your maxillary sinuses, and you're looking for any nodules, swelling, or tenderness to pain. And then after that, you can do your transillumination with your otoscope.
Hey, go ahead and actually show me.
Okay, so let me show you this one because it's actually kind of cool. Okay, so once the lights are dimmed, you go ahead and you place the otoscope right here. And what you're looking for is, you see, oh no, I had it just a second ago. Not too low. Right there. You see how you can see the globe of light right there? And then this one here. you should be able to see that globe of light. It's kind of hard. You have to really dim the room. And then inside, what you do is you place it right here, and you have them open their mouth, and you should be able to see the globe of light showing through the roof of their mouth, just showing that the sinuses are clear. And that's called transillumination. Okay? The next part is going to be the mouth, throat, oral cavity, and all that jazz. Okay? So the first thing you would do is you put on gloves. I'm just going to talk through this, but you put on gloves and you'd be inspecting and palpating the lips, just making sure that they're supple, making sure that there's no nodules or anything like that. After that, you're going to have the patient open their mouth, and you're going to be inspecting and palpating not only the gums and the teeth, but you're physically going to be palpating the gums, looking for any pain, any lesions, anything like that. And then you're also going to be palpating the teeth. You can use a tongue depressor at this point and just making sure that if there is tooth pain, that's a dental issue. If there's tooth pain, but then when you touch it, it's not there, that's a sinus issue. Okay? After that, you're going to be looking at the structures within the mouth, and this is where you're looking at the tongue, the oral mucosa. You have the patient move their tongue around, looking at all aspects of it, looking at the floor of the mouth, looking at the soft palate and the uvula. And what you're going to do then is actually grab the tongue with a piece of gauze, and you're going to move it and check all those same things. You're going to palpate the floor of the mouth, and you're also going to elicit the, with a tongue depressor, you're going to have them say ah, and you're going to have the movement of the soft palate and the uvula, indicating that cranial nerve 10 is intact. Lastly, you're going to be inspecting, again with a tongue depressor, looking in the back, looking for the tonsillar pillars, looking at the posterior wall of the oral pharynx for edema, swelling, any of the issues that we talked about in class. And lastly, you're going to elicit the gag reflex on both sides of the uvula. I would just verbalize that one though. But after that, you're done. That's the entire Heent Pcl with several errors. So enjoy.